The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Joshua Potter. I'm the Director of Compliance here at PRS Pharmacy Services. I'd like to thank you all for attending today's webinar, HIPAA 2013, Don't Panic, Be Prepared. As most of you probably have heard in the past couple of months, there's been some changes to the HIPAA rules as it comes to how you need to comply with it, and also how enforcement and penalties are going to be levied on for non-compliance. Today we're going to be covering 5 different areas. First, the Omnibus HIPAA rules, which are the changes that were released in January of 2013, the upcoming audits, civil and criminal fines, and then 2 areas that were found to be rather deficient during the pilot audit program between 2011 and 2012, and that is the risk analysis and the disaster recovery plans. In general, HIPAA is manageable. It's not a complicated subject. It just takes time. So, you can pay a consultant to help you create your program, but, paying them thousands of dollars to come on site to actually implement the program for you, in many cases is going to create more problems than anything else, as your privacy officer and security officer, may not have a full understanding of your HIPAA program itself. And when that consultant leaves, they're going to be taking a lot of that understanding with them. Also, when it comes to HIPAA training, you need to understand the HIPAA training itself needs to be based on your policies and procedures and not the regulations themselves. Of course, your policies and procedures should be based on those regulations, but the training itself needs to be based on your policies and procedures so your employees know what they need to be doing. What you do need is you do need a policy and procedure manual. You do need to train your employees on your policies and procedures, and you need leadership. Based on some of the pilot audit program findings that was released so far, this is one of the areas that was deficient in many covered entities. First, you need a privacy officer to oversee your overall HIPAA compliance program. You also need a security officer to oversee how your facility, how your pharmacy is going to handle electronic protected health information and help ensure the confidentiality, integrity, and availability of that information. But you also need your ownership and management to take a lead role when it comes to making the pharmacy understand, making the pharmacy employees understand what they need to be doing, and the pharmacy is taking HIPAA seriously. Now we're going to talk about the Omnibus HIPAA. These standards were released in January of 2013. Overall, it increased the consumer protections when it comes to the privacy role, and also had some changes to the security role and the breach notification role, which we'll go over in a couple slides here. It is going to force you to amend some of your policies and procedures, again, which we'll be going over some of those. It also increased the penalties and increased the Office of Civil Rights' ability to enforce the overall HIPAA compliance on covered entities. There's 3 deadlines when it comes to the Omnibus HIPAA rules. The first deadline is already passed, and that was March 26 of 2013. It was at that point in time that every new covered entity, pharmacies included, when they opened up, needed to be compliant with the new rules. Also, if you've amended any of your policies and procedures after March 26th, they need to be compliant with the new rules. As of September 23, 2013, that is when every covered entity needs to be compliant with the new regulations and the new standards. And on September 22nd of 2014, all your business associate agreements that are in place, that were put in place prior to March 26th, need to be compliant with the new rules. I want to talk about some of the changes to the actual regulations themselves with the Omnibus HIPAA rule. With the security rule, there really wasn't many changes that are going to affect pharmacies and other healthcare providers in general. But what has changed is now your business associates must comply with the security rule when it comes to electronic protected health information. They're going to be forced to create policies and procedures that will help them ensure the confidentiality, integrity, and availability of that protected health information. With breach notification, there's been one rather large change, and that's the risk of harm has been removed. With the original breach notification rule, you only had to report a breach if there was a risk of harm to the patient themselves. That's been replaced by low probability the PHI has been compromised. So if there is a breach of protected health information, you have to report it unless you've performed an analysis that that you've determined that there's a low probability the PHI itself has been compromised. So it doesn't matter if there's a risk of harm to the patient themselves. If that PHI has been compromised, then you have to report it. In general, we still have the same notification rules. You need to notify the individual within 60 days of discovery for any breach of protected health information. If the breach was of 500 or more individuals, then you need to notify the Department of Health and Human Services within 60 days of discovery. If the breach was less than 500 persons, then you need to notify the Department of Health and Human Services within 60 days of the end of the year that the breach was discovered. And they left in there that if it is a breach of 500 or more, you need to notify media outlets also. It's when it comes to the privacy rule that we see the majority of the changes. And just as a quick note, at the end of the webinar today, we're going to be going over some of your questions. If you want to submit a question, you can use the GoToMeeting client and type in your question there, and we'll be going over those at the end of the webinar today. But like I said, the privacy rule took most of the changes when it comes to Omnibus HIPAA. First, your notice of privacy practice is going to need to be amended. You need to include authorization statements in your notice of privacy practice that you will get an authorization whenever you're going to be selling protected health information for marketing purposes and the uses and disclosures for psychotherapy notes. You also should include a statement in that other uses and disclosures that are not permitted by the HIPAA regulations that you'll actually seek an authorization from the patient before releasing that information. For fundraising, you now need to include a statement in the notice of privacy practices about the patient's ability to opt out of fundraising activities. In the past, we only had to do that when we actually performed fundraising. Now it actually has to be inside the notice of privacy practices itself. Some more changes to the notice of privacy practices. You need to include a statement in there that you will notify the individual in the event of a breach of their protected health information. And another change here is request for additional restrictions. The notice of privacy practices needs to state that if a patient is going to be paying out of pocket and their health plan is not going to be paying for anything, that they're permitted to request that you do not disclose that information to the health plan itself. And this is also a policy and procedure change here that, and we'll be going over a couple slides here, that you have to honor that request unless it's unless state law or federal law mandates that you actually have to submit that claim, such as in the case of Medicare Part D and C, the Advantage plans. There's been a change to the access of records policy and procedure. In the past, you were allowed to provide the patient with access to records that were held off-site within 60 days. That has been changed to 30 days only. So whether the records are on-site or off-site, you have 30 days to provide that information. You are permitted to request a 30-day extension, as you were before. Another change is when it comes to electronic protected health information. If you are maintaining health information in an electronic format, then you have to provide that patient with an electronic format version of their protected health information, unless your system is not capable of doing that. So in the events of most pharmacy computer systems where we're not capable of exporting the data out, you're really not going to be able to abide by this request, and that's okay. And additional restrictions here, as I said during the notice of privacy practices, you are going to get change your policy and procedure when it comes to additional restrictions. Particularly, you cannot disclose protected health information for products and services that have been paid out of pocket by the patient. And again, the exception is, if the disclosure is required by state or federal law. There's been a change to immunization records. You're now permitted to disclose immunization records to schools at the request of the patient, parent, or guardian based on a verbal request. In the past, you needed to have that request in writing. Now it can be verbal. You just want to make sure that you document that you did disclose that information, what was actually disclosed, and who you disclosed it to. the deceased. When it comes to the deceased, you're still permitted to destroy that protected health information after 6 years, or as permitted by your state laws. Some states have longer protections where we have to protect health information of the deceased for longer. But HIPAA still allows you to destroy those records after 6 years or whatever your state allows. If you're going to be maintaining it for more than 6 years, you have to ensure the protection of that protected health information for up to 50 years. Basically, this rule here is they don't want you to be selling protected health information of the deceased after 6 years. They want you to destroy it, unless your state says you must keep it longer. Fundraising activities, first and foremost, treatment cannot be conditioned upon fundraising. And you need to include opt-out notice. Of course, that opt-out notice needs to be included in your notice of privacy practices and sent with all fundraising requests that are sent to the patient themselves. In the opt-out, the patient should incur no undue expense other than the cost of writing a letter, filling out a form, and a stamp to mail it. And in general, most pharmacies are not doing too many fundraising activities. But if you are doing these kind of activities, you want to make sure that you follow these rules. Now, if you're going to be handing the patient a fundraising notice when they walk into the pharmacy, that's still perfectly acceptable. It's whenever you communicate directly to them via the mail or you disclose this information to an outside organization or institution such as a children's hospital or some sort of charity group. Now, the business associates, there's been a big change to how business associates are going to be policed when it comes to HIPAA. When it came to breaches in the past, a lot of those breaches did occur at the business associate level. So Office of Civil Rights for the Department of Health and Human Services is going to begin policing business associates just as they will begin policing covered entities like pharmacies. But you will need a new business associate agreement. There's a template online at the Office of Civil Rights website. And at the end of the webinar today, well, possibly not today, but within tomorrow or the next day, you'll receive an email from us with a link to the new template and also some of the other links on that website that are going to be relevant to pharmacies and healthcare providers. Your existing business associate agreement is going to be effective until September 22nd of 2014. So if you have any in place right now that were put in place before March 26th of 2013, you can continue to use those until September 22nd of 2014. At that point, you will need to switch to the new template. But in general, business associates are now going to be held accountable for any breaches and violations of the law itself. So, that took some of the burden off covered entities where we were forced to make sure our business associates will be in compliant. And now the Office of Civil Rights will be investigating business associates also. Now, when it comes to a business associate, what are they? Well, they're any non-employee or entity that has access or receives your protected health information. Typically, they're using that protected health information to perform a service on your behalf. These can be computer software companies, billing companies, patient safety organizations, such as ISMP and a couple others where they record medication errors and things like that, and you can submit to them anonymously. Couriers, if you're using couriers to deliver medication and items like that. When it comes to internet service providers and mail handlers like the U.S. Postal Service or UPS, they don't fall into a business associate agreement level. If you have a healthcare provider performing a service on your behalf, then they would be a business associate. But if you're just contacting them to get a refill for a prescription or a new prescription, that does not make them your business associate. Another big change when it has come to business associates is business associates can now have business associates. In the past, there was only one level from covered entity to the business associate, and any subcontractors were not liable for the HIPAA regulations themselves. That has changed. So if you disclose protected health information to a business associate and they disclose it to another business associate of theirs, that goes down the line where everybody's going to be forced to be compliant with the security rules and breach notification. The authorization, the new rules gave us 3 clear examples of when we need to get authorization from the patient. First, whenever you're going to be using or disclosing psychotherapy notes, in pharmacies that really doesn't, we really don't do that. But when we're going to be selling protective health information, we will need to get an authorization from the patient. Now, the only exception to that rule is if you're selling part or all of your business, you do not need to get the patient's approval to do that or authorization to do that. If you're going to be using their protected health information to market to them, or you're going to be getting paid by an outside entity to market to a patient, you want to make sure that you get their authorization ahead of time before you do that. If you're just sending them refill reminders at your own cost, you're still permitted to do that, but if a drug manufacturer was to pay for that service, you would have to get an authorization from the patient to do that. Now I want to talk about the disaster recovery and contingency plan. Overall, a contingency plan is an established process that would be used in the event of a disaster to help you move back into normal business operations. The disaster recovery aspect is actually just a part of a contingency plan itself. But when we're talking about the contingency plan, there's a couple things you're going to need to have in place. You're going to need a data backup plan. Most pharmacies save their data on a nightly basis. There are some pharmacies out there and their software companies that actually are continuously saving backups via the internet at a remote storage facility. But you need to have an understanding on how that information is being maintained and how you can retrieve that information if you ever did need to retrieve it. The disaster recovery plan is basically you need to establish a process on how you're going to restore any loss of data to make sure that your pharmacy is going to be back up and running in a minimal amount of time as necessary. And also emergency mode operations, another aspect of the disaster recovery plan. What's that process that you're going to go through? Who are you going to contact to actually get back up and running when a disaster does strike? Testing and revision. I'll explain what the addressable means after these 2 points here. But you need to periodically test and revise your disaster recovery and contingency plan as necessary to really meet your operations. And then applications and data criticality analysis. You need to understand what hardware and what software is critical for your business. When it comes to addressable, both of these standards are addressable. And what that really means is if you have a reason why you shouldn't be doing this and that reason is good, you need to perform a risk analysis to explain why you're not going to be doing that. When it comes to testing and revision, pharmacies are really not going to get away with making that addressable. It's basically required for all pharmacies. You want to test and revise your disaster recovery plan and contingency plan on an annual basis or so, especially if there's been any changes to your operation. When it comes to the applications and data criticality analysis, this is something that a pharmacy would possibly be able to make addressable. In most pharmacies we have one pharmacy computer system, one pharmacy software. There's other computers that are connected to it, but in general, it's that pharmacy server that's critical to our business operations. Now, what is in the disaster recovery plan, the contingency plan? First, contact information for management and ownership in the event that they're not there if a disaster did occur. Employee contact information, so you can contact employees that are going to be performing a function during a disaster situation. Utility contact information, who's your gas supplier, who's your electricity supplier, and so forth. Wholesaler contact information if you were to lose your drugs or lose front-end stock, who are you going to call to get that stock brought back into the pharmacy. Your data restoration information, how are you going to restore data. Software and hardware vendors, if your pharmacy system is destroyed, what's the quickest way you're going to be able to contact your software company and get the software reinstalled into a new computer system. If you have an alternate site, you want to have information related to that alternate site so you can contact them, have the address information, and all the phone numbers switched over. Employee responsibilities, you want to make sure your employees understand what their responsibility is going to be during a disaster mode. And then an overall process on how you're going to normalize business operations in the event of a disaster. As I said earlier, this is one of the areas that during the pilot audit program was found to be deficient in many providers that were audited. Now I want to talk about risk analysis. The risk analysis plan is basically an assessment of the potential risks and vulnerabilities to your electronic protected health information. So you need to understand how your pharmacy uses electronic protected health information. How it's created, how it's maintained, how it's transmitted, and how it's accessed. You want to make sure you're aware of any mobile devices that are used within your pharmacy to access your networks. And you also want to be aware of any remote users that may have access from outside of the pharmacy itself. You also want to have a good understanding of what the human, natural, and environmental threats to your computer systems and networks are. When we talk about human threats, that's going to be poorly trained employees, disgruntled employees, hackers, things like that. When we talk about natural threats, that's going to be tornadoes, hurricanes, earthquakes. Depending on where you're at in the country, you're going to have different natural threats that exist to you. And then environmental threats. Those are going to be things like power outages, internet service providers going down, telecommunication failures. But in general, there's several elements to a risk analysis. First is the data collection. That's when you're going to collect all the data relevant to how you're maintaining, transmitting, storing, and accessing electronic protected health information. Then you want to identify and document potential threats and vulnerabilities that exist to your pharmacy. What are those threats? If you're in the southeast, and things like hurricanes, in the Midwest and the southeast, tornadoes. What programs do you have in place to help prevent those kind of issues? Not prevent those, but to mitigate any potential issue. And you also want to assess your current security measures. Now, typically we recommend that you implement all of your security role compliance policies and procedures prior to doing your risk analysis. The reason why we do that is, with the security role itself, once you implement a lot of these policies and procedures and necessary practices, you're going to be covering a lot of your potential threats and vulnerabilities. You may need to create additional policies or practices to fill in some gaps. However, but at least you have a good start. So you want to assess your current security measures, those current things you put in place for the security role, to see if they help mitigate or eliminate any potential threats or vulnerabilities. Once you do that, you want to determine the likelihood of a threat actually occurring. With all your safeguards in place, how likely is that threat to occur? You also need to determine if it did occur, what would be the impact to the pharmacy itself. And then based on that, you want to determine your overall level of risk. And then you want to see what you're comfortable with. In certain circumstances, you can only do so much. You're not going to be able to completely eliminate a threat or a vulnerability. So you want to see, what you're able to do and make sure it's, cost effective to actually implement new rules or new practices. Or at times, you're just going to have to make sure you're doing all your data backup, so if something does happen, you can quickly get back on your feet again. Now I want to talk about the civil and criminal fines. With the Omnibus rule and with the high-tech rule itself that preceded the Omnibus rule, there's criminal and civil fines. For the civil fines, the non-criminal fines, each violation can be from anywhere between $100 to $50,000. If you have violations that are identical in nature, you can go up to $1.5 million for those violations. But that's not the maximum. If you have multiple kinds of violations, you can go above that $1.5 million. If non-compliance is found to be criminal in nature, first, there's the monetary penalties of $50,000 to $250,000 or imprisonment from 1 to 10 years. These slides kind of speak for themselves. Now I want to talk about the audits. Now, in 2009, with the passage of the American Recovery and Reinvestment Act, Congress mandated that the Department of Health and Human Services begin conducting compliance reviews or audits. These pilot audits lasted from the first phase was the pilot audit program, and these lasted from 2011 to 2012, where they audited 115 different covered entities, 61 of which were healthcare providers. We're still in the process of our Office of Civil Rights is still in the process of the final review, which should be released in September. Once that review is done, this will lead to a proactive versus reactive audits. In the past, HIPAA audits occurred when there was a documented breach or there was a complaint received by the Office of Civil Rights. Now there's going to be proactive audits too, where they're going to actively go out and conduct compliance reviews on covered entities and business associates for that matter. But in general, what they released so far about the pilot audit program, risk analyses were very poor. A lot of entities do not have a disaster recovery plan. There was a lack of an understanding of the rules themselves. So in other words, there were a lot of policies and procedures that just did not exist. There was entities that were just simply handing out the notice of privacy practices. That's not enough to be HIPAA compliant. Outdated policies and procedures. If your operation changes, you want to make sure you review your policies and procedures to make sure that you're still compliant based on those policies and procedures. No ownership of the compliance. This goes back to one of the first couple slides that we went over. You need a designated privacy officer and a security officer, and they need to take responsibility for the program itself, but also ownership and management needs to take a leadership role when it comes to HIPAA compliance. And also with the pilot audit program, I said 115 entities, covered entities, were audited, 61 of which were healthcare providers, including pharmacies, 2 of which were found to be completely non-compliant with the only 2 were found to be compliant with the regulations themselves. So that leaves about 3% were actually compliant. The other 97% were not compliant with the rules and regulations. Now, Leon Rodriguez, who's the director of the Office of Civil Rights, has stated that the permanent audit program should begin sometime at the end of 2013 or the 2014 fiscal years. Technically that could be sometime between now and the end of September 30th for the 2013 fiscal year, or sometime thereafter for 2014. I would expect to start seeing the audits, or at least the audit information being released, the end of September to the beginning of October, and the audit starting soon thereafter. And just as I stated before, a covered entity must train all their members of its workforce on their policies and procedures. You can purchase a canned training program, but you want to make sure that you tweak that training program so it actually meets your policies and procedures, because that is what the regulation says it must meet. So, some of those canned program education and training programs are very good, and your employees may be learning something, but you're really not going to be compliant with the regulations themselves. So, make sure you do tweak that training if you do purchase canned training to meet the policies and procedures. I want to open up the webinar to questions. If your question's not answered today, or you don't have a chance to ask it, you can give us a call at 1-800-338-3688, or send us an email at prsinfo@prsrx.com. And our website for HIPAA is www.prspharmacyservices.com/HIPAA. All right, I'm going to open up the questions now, see if we have anything. Bear with me as I open everything up and get it ready. I have one question so far. How does a PBM's record retention requirement, example 10 to 12 years, affect HIPAA record retention requirement of 6 to 50 years? You would have to comply with with that PBM. With Medicare Part D, you're forced to keep those records for 10 years. So when it comes to HIPAA, you now need to maintain and protect that information for 10 years when it comes to Medicare Part D and Part C, the Advantage plans. When it comes to Medicare Part B as in boy, you need to keep that information for at least 7 years. So you would have to maintain and protect that information for 7 years. And then if you have state laws that are in place in your state that does require you to keep information for longer than 6 years, you must ensure that information is protected. And again, on the right-hand side of the screen on your GoToMeeting client, you're able to type in questions, and I can read those off and answer those for you. So, please do so at this time. I have a question about the out-of-pocket HIPAA information. I assume this is for if they don't want you to disclose that information, can that ever be disclosed? It depends on who you're disclosing it to. When it comes to a patient saying, I'm going to pay out of pocket and don't disclose this to my insurance plan, you're not going to be able to disclose it to that insurance plan unless you're required to do so by state or federal law. If they don't want you to disclose information to a state narcotic reporting, they can't ask you not to do that. So if your state does require you to report narcotic prescriptions, you would still need to report that. That particular role is just in regards to reporting that information to a health plan. Would a cleaning service be considered a business associate that would need an agreement? Technically, no. When it comes to a cleaning service, they should not be seeing protected health information. When they would come into your facility, you'd want to make sure that your facility is relatively sanitized when it comes to your protected health information laying around. Because the main reason for that is, a cleaning service is not going to be has no need to use or disclose your protected health information. So the business associate agreements are really not written for them. But if you have protected health information laying around, that can be considered a breach. Will the audits be unannounced? During the pilot audit program, they were announced. As of right now, for the permanent audit program, and they haven't announced how that process will be handled. Is a Medicare Part D patient allowed to not submit an RX to their Medicare D plan? No. Federal law states that you have to submit those claims to Medicare, especially for the TROOP, which is the true out-of-pocket cost equation that they use. Are we required to have patients sign a new HIPAA privacy statement with our pharmacy? No. If they've signed one in the past for you, you do not need to get them to sign a new one. You just need to make sure you have new patients sign for the new notice of privacy practices, and you need to give it out to anybody who does request it. How much does it usually cost for someone to come down to the pharmacy for HIPAA training to those who need to be trained? Well, it depends on who you use, what kind of service you use. In general, if you're going to be purchasing a policy and procedure program, you want to make sure that there's actually HIPAA training in that policy and procedure program that is compliant with that policy and procedure program. So typically that would be included in the cost if you want to train your employees yourself. But if you do want someone to come out there, that cost can be from hundreds to thousands of dollars, depending on what kind of service you use. Would there be an updated version for the disaster recovery plan from PRS if our current plan is out of date? Yeah, the PRS program, HIPAA Track, it does include an up-to-date disaster recovery plan, along with all the other necessary documents that you need to be compliant, including the policies, procedures, risk analysis, security evaluations, and so forth, along with the notice of privacy practices for your pharmacy. Just as I'm waiting for a couple of questions to appear, if you do have any more questions, we are going to be at the PFOA, the Pharmacy Franchise Owners Association, on September 23rd in Nashville, Tennessee. The Pennsylvania Pharmacy Association in Gettysburg, Pennsylvania on September 27th, 28th. Then, of course, we'll be at the NCPA convention in Orlando on October 12th through the 15th. E-scripts are normally received. How will we know if a patient does not want that sent to the insurance prior to arrival at the pharmacy for pickup if the provider does not let us know? You won't know, so you'll be permitted to submit that to their insurance company unless they notify you in advance. So you don't have to worry about that if it is a prescription service. But if the patient did tell you not to submit these to their insurance company, then you would have to abide by that. Where are the new business associate agreement templates? They're on the Office of Civil Rights website for health insurance or for HIPAA. If you just go to Google and type HIPAA, typically the very first link on the non-paid links is for the Office of Civil Rights, and you can find the business associate template there, agreement template there. Also, you will be receiving a follow-up email from this webinar, and the link to that will be on the follow-up email itself. When it comes to HIPAA Track, if you purchased our original program, if you purchased it after January 1st, 2010, there is a discount. If you purchased it before January 1st, 2010, then the only discounts that are available are for buying groups. So if your buying group is part of FPN or you're part of NCPA, you will receive a buying group discount for that. But again, the only discounts for purchasing a previous program was if you purchased the last version of the HIPAA program itself from PRS, which came out in January 1st, 2010. Is there an update only for the pharmacies who purchased PRS pharmacy program in the past that includes policies and procedures, or must we repurchase the entire program? Our new program is a complete rewrite, so it's not an update, it's a brand new program, so there is no update only. But again, anybody who purchased the last version of it after January 1st, 2010 does get a discount for the new purchase. So no other questions right now. Stay online a couple more minutes, see if anybody has any questions. Just kind of explain what HIPAA Track is. The HIPAA Track program, presented by NCPA and powered by PRS, is a brand new program that we're offering that's internet-based. Includes all the policies and procedures needed to comply with the final HIPAA rules. It also includes online training and the tracking of that training. So when you log on to the website, you can give your employees access by giving them a username and password based on their email. And they'll be able to go online, take the training, and that training will be documented. Again, it includes all the policies and procedures, forms, disaster recovery, risk analysis management plan. If there's ever an update, that update will be automatically applied to your policy and procedure manual for the length of your term, which is either 3 years or 1 year, Email notifications, so when there are tasks that need to be completed or new things have happened in HIPAA, you will be notified. Also, with the initial offering of HIPAA Track, we're providing access to something that we're calling exclusion track for the initial term of your HIPAA purchase. And what this does, this takes a list of employees that you've provided, that you've added to the system, and it performs the monthly OIG and GSA SAM exclusion list checks, again on a monthly basis as required by Medicare Part B and Medicare Part C and D. And what will happen is we'll run that check automatically on a monthly basis, and then we'll notify that check has been done and if there was any name matches on one of those databases. It also includes a 1-year access to a license track, which is with those employees that you did add to the system. You can also add licenses to them, so when their license is ready to expire, you will be notified in advance. I don't see there's any more questions yet. And I'll stay online here, answer any questions. Any other questions related to the Omnibus HIPAA rules itself or the PRS program? How much is the cost of the HIPAA track program? Depending on when you purchase, if you did purchase our last program after January 1st, 2010, the price is $531 if you're part of a buying group, an FPN buying group or NCPA. If you haven't purchased or you purchased before January 1st, 2010, then the price is $831, again, if you're an FPN member, buying group, or NCPA. And those are the prices for 3 years. Does the HIPAA track program include a CD, DVD that allows the end user to customize the individual policies and procedures? It does not include a CD or DVD version, but you can actually download the entire manual and customize that manual on your facility itself. If you don't want to customize the manual, then the website will have all your policies and procedures that you need. The only thing you would want to do is print out any forms that need to be completed. So, the essence of the question, yes, there is a way to download all your policies and procedures and customize those, but it's not a CD or DVD based. It's internet-based, so you can download those, and they are readable Microsoft Word documents, so they can be edited and customized to your particular operation if need be. Is it possible to access the webinar again? You will receive a copy of the webinar, the slides themselves. We're also recording it, so hopefully it should be clean enough that we can allow people access to it, depending on how bad I messed it up. The $831 you said is for a 3-year membership. Yes. With the $831, you get 3-year access to the HIPAA track program. So during the length of time of that 3 years, if there's any updates that need to be put in place for HIPAA, you'll automatically receive those. And then also with that, you'll get access to 3 years of the exclusion track and 1 year of license track. Can you personalize the online version of this program? No, you cannot. The main reason for that is, we want to make sure that any policies and procedures or forms that are on our website, we know are compliant with the regulations. So if you do change those or personalize any of those policies and procedures, you will have to maintain that on your own computers. As time goes on, we're going to start allowing access to actually save the disaster recovery and risk analysis on our website, but as for customizing policies and procedures, that probably won't be anytime soon. If you have any questions, additional questions after the webinar is over, or you just want to take a look at the program itself and get some answers on the program itself, if you go to give us a call at 1-800-338-3688, not 99. Yeah, so 1-800-338-3688, or go to prspharmacyservices.com/HIPAA. You can get more information on the program itself. Where can you find the policy form change? If you're talking about where can I find the regulations themselves, they're on the Office of Civil Rights website, which will be included in the follow-up email, and they were included in the Federal Register, so from, I believe it was January 25th of 2013. But there will be a link to that on the follow-up email itself. And with this change in HIPAA, we're also updating all of our compliance programs to something we're calling the PRS Compliance Assistance Programs. These will all be online versions of our policies and procedures, and you'll be able to access those from any computer. But we're going to have our fraud, waste, abuse track to comply with the Medicare Part D requirements, quality assurance track to handle medication errors and things like that, continuous quality improvement. Immune track, which is going to be our immunization program. HAZCOM track, which is going to be the hazard communications for training for OSHA, and others as we customize those to really meet what new regulations are out there and changes that we want to put in place. So this whole suite will be available from one website when it's purchased or when they're purchased. So as you purchase HIPAA or purchase Immune Track, they'll automatically be on the exact same website. So you just need to go into that one website to get to the policies and procedures. You want to make this as easy as possible for pharmacies, so they don't need to have many different booklets and manuals and different websites they need to be going to have their policies and procedures. And another one of the programs will be a I don't have a good name for it, but Train Track. That's going to allow you to actually upload any facility trainings that you have for your employees, and they're going to be able to go online and take that training, and that training be tracked. So again, depending on those other programs, like unfortunately the Train Track program, it'll allow really our customers to kind of dictate how they want to use the software itself. Yeah, each of these programs will have a separate cost associated with them. And bundles and discounts can be applied depending on the particular program or our promotion that we're offering at that point in time. It doesn't look like there's any other questions yet. Again, if you have any questions, you can use the GoToMeeting client to type in your question, and I can answer that question for you. All right. If you do have any questions, you can give us a call at 1-800-338-3688, or send us an email at prsinfo@prsrx.com. And if you're already a member of HIPAA Track, you can give us a call again at 1-800-338-3688, or you can email us at membership@prsrxnetwork.com. I have another question here. Does a pharmacy that does not do fundraising still have to include or mention fundraising practices in its notice of privacy practice? Yes, you should always make reference to those, because anything that's not in your notice of privacy practices, you're not going to be able to do, or you're going to be forced to get an authorization. So you want to make sure that you do include the fundraising statement in there. When it comes to pharmacy and HIPAA, there's a lot of policies and procedures that, most pharmacies are never going to need, but unfortunately, we do need to have those in place just in case we do ever need those. All right, looks like that's all the emails. If you do have any questions about HIPAA track presented by NCPA and powered by PRS, again, please give us a call at 1-800-338-3688 or send us an email to prsinfo@prsrx.com or to membership@prsrxnetwork.com. Another question here, how often does HIPAA have an update? Well, in the past, there were not too many updates. This is the first major update. When HIPAA first came out in 2003, it was just this privacy rule. In 2005, they added the security rule. And then in 2009, the high-tech rules went into effect, or some of the high-tech rules went into effect. And now in 2013, we have the Omnibus rules, which took a lot of the old high-tech rules and updated them and added a couple enforcement rules to it. So, as of right now, there hasn't been too many changes to HIPAA. All right. I'd like to thank everybody for attending today's webinar. And again, if you have any questions, please give us a call. The contact information will be included in the follow-up email. And I hope to speak with you all soon. Thank you.